Hi, this is Dr. Doreste with the Cranial Release Technique, back with another video, doing something a little different today. I get requests all the time about what's one of my favorite tests to do with cranial release, to explain to a patient the need for cranial release technique. And probably one of my favorites, let me just move this camera a bit, probably one of my favorites is the push test, which I use just a regular piece of copy paper. I'm going to place this on the floor. We happen to have the beautiful Soledad here with us today. I'm placing it on the floor, and I'll show you with the camera in a minute what we're going to do. Soledad, come on over. Just put your feet on the edges of the paper and face the camera, on the outer edges. So I tell the patient, just place your feet on the outer edges of the paper. Hopefully you're seeing that now. So her feet are on the very edges. Just go a little wider, so you're just wider, so you're just touching the very edges of the paper. Good. So now the patient's going to keep their feet right there, and I'm going to come along, and I am going to, hands out of the pockets, please. I'm going to now put my hand right on the iliac crest, right on the patient's iliac crest, right on the hip, and I'm going to press straight across. I'm going to ask the patient to stay in neutral and resist me. And what I want is for her to stay there. I don't want this happening. Just relax. I don't want that. I want her to stay in neutral. Good. So you're going to stay in neutral, and I'm pressing straight across, and I'm loading up very slowly. And I'm also keeping my hand here because with some very frail people, they may just fall over. We don't want, obviously, any injuries. So, Soledad's going to resist, and I'm pressing. Resist. And I'm pressing, and I'm leaning in. I'm driving this way through my hand on her pelvis. Nice and strong. Now we're going to go to the other side. We're going to do the same thing. Straight across. I like to keep my hand here in case she's very weak. And I'm just pressing, pressing. Okay. So she's very strong both. So that's what we want. That means the center of gravity, the head, is right over the middle of the body, which is what we want. Soledad gets CRT on a regular basis. I'm expecting her to pass that test. Let's pretend she's a real patient. And let's pretend I go to do the same test, and I tell her to resist, and I start to load up, and she falls over. And I said, no, resist, and we go, and she falls over. And then I might go to the other side, and she might be stronger, or she might be weaker there too. This is a great test. Thank you, Soledad. This is a great test. Any words of wisdom for the camera?
No, it's an easy test.
It's an easy one. It's a very good one. It's a very effective one. And they feel, let me move this camera so you don't see the ceiling fan. So, and that's too dark. So let's go this way. Oh boy. Sorry for the camera work here. So that's a very simple test that tells me if they're in fact in balance. Now, I can tell you from a lot of experience, 8 or 9 or 10 out of 10 people are going to fail that test. And now I would apply the cranial release to both sides like I do on everyone, and I would make them walk just for a minute or two to let the nervous system sort of reset itself, and then reapply the test. And I'm expecting to see improvement. I'm expecting to see they're stronger, they feel more balanced, and that's a great simple test, and it takes a minute. Now, here's the downside of doing this test. I've done this before and just applied traditional chiropractic, and I have not seen that test change. It seems that you have to get to the central nervous system through the cranium, that's the only way I know how to do it, to change that test. So if you're a practitioner, you're a massage therapist, you're an acupuncturist, you're a chiropractor, you're a naturopath, do this test. Do this test before your visit, and you'll see they'll fall more easily to one side versus the other. Do your treatment, whatever that is, your adjustment, your needles, your massage, your deep tissue, your myofascial, whatever it is that you do, have them come back, redo the test. If it doesn't change, then you didn't get to the central nervous system the way that I'm talking about. So for those practitioners, you might want to consider learning the cranial release technique, and you can do that by visiting our website at cranialrelease.com. There's a button there called Online Training Program that will show you how you can learn this technique in the comfort of your home or office. If you are a practitioner and you are a cranial release technique practitioner, well, I invite you to come December 2nd to the CRT Mastery Review, which is going to be here in Fort Lauderdale. It's going to be a full day of all things cranial release technique. All the details are on the website at cranialrelease.com. Click on the live events tab and you can see where we're going to be and the details for that. And you can register for that. I capped that event at 15 seats. 3 are sold. We got 12 to go. It's December 2nd. So if you're interested, jump on. Be there or be square, as they say in Peru. So, hey, that's a joke. And I got her to laugh. There you go. All right? And for those of you that are not practitioners and you'd like to learn more about the cranial, mom could do this to her kids and you'll see discrepancy. Dad could do this to mom. You can have fun with this and you'll see that there's distortion. Then you need to find a cranial release technique practitioner. And for that, you can go to the website and click Find a Practitioner, and hopefully we have someone in your area. Okay, all the details at cranialrelease.com. Thanks for your time. Have a fabulous day. Dr. Doreste saying over and out. Cranialrelease.com. You have to get to the central nervous system to balance this. Because if you don't correct this, and you are carrying more weight on one leg versus the other, gee, I wonder why one hip needs to get replaced, one knee needs to get replaced, ankle pain, foot pain, lower extremity pain on one side more than the other. It could very well be where the head is in space, and CRT will help correct that. Thanks so much, my friends. Be well. Adios. Have a good day.